Welcome, everybody. Thank you so much for joining. My name is Jillian Brady, and I welcome you all to the Alliance for Safe Online Pharmacies Global Foundation webinar on HIV prevention and treatment to discuss the threats of illegal online drug sellers to public health and patient safety. Maybe we will give folks a minute to settle in here. But just want to thank everyone for joining today, and we'll kick things off with a few housekeeping items, and then I will move into the agenda. So for those of you on the line, just to note, participants will be entering and remaining in listen-only mode throughout the webinar, so you'll be kept on mute. But we encourage questions, comments to be submitted throughout the entirety of the webinar using the Q&A panel, and we'll go through those steps in a moment. But we just want to take this time to encourage you all to use that panel to submit questions, but we will be waiting until the end, till the moderated discussion to answer any questions that folks may have. A friendly reminder, slides will be made available after the webinar, so if you have if there is any materials you'd like to review, we'll be sending that out after this webinar, and you'll receive an email. And to submit any questions or comments, again, you want to open the Q&A panel, which for most of you should be on the right-hand side when you join. When you do, you'll select all panelists, including moderators and presenters. You'll type your question in the text box as shown in the images to the right and hit send. And just to note, your name and question will appear in the Q&A panel, but only the moderators and the presenters will be able to see your questions. So the rest of the attendees won't be able to see your question. And as I said, we'll wait until the moderated portion of this discussion or this webinar to discuss the question. And with that, I'm going to hand things over to our two esteemed presenters today. We have Libby Bainey, ASOP Global Foundation Senior Advisor, as well as John Hertig, the ASOP Global Board President. And with that, I will hand things over to Libby to present.
Thank you. Thanks, Jillian. Thank you for everybody to be here. And good to see you again, John. Thank you for your leadership on this, along with the foundation. So I'm Libby Bainey. I've been leading the Alliance for Safe Online Pharmacies Global and the Alliance for Safe Online Pharmacies Foundation since both were formed about a decade or more ago. I work with the board and both at the foundation level and at the global level to make sure that we come up with an agenda, research, and advocacy materials that will inform patient safety globally when it comes to internet purchasing of medicines. This issue couldn't be more timely, and you're going to hear from John about some recent data that the Alliance for Safe Online Pharmacies Foundation sponsored to understand what's happening with Americans purchasing online today and why does this issue matter, especially for the HIV population, increasingly vulnerable and needing access to medicines. I'm also going to talk a little bit about just why does ASOP exist generally, not just for this population, but for the community as a whole. We've got a global organization with chapters here in the United States, Canada, Europe, and as well as activities around the world to work with regulators, healthcare professionals, law enforcement in some cases, and patient safety organizations in allied ways to bring education and resources to you. So I'm really excited because we have a toolkit that you're able to use right after this webinar. You can click into, download fact sheets, data, reports, anything you might want that will further your interest in patient safety online and help you educate patients and other healthcare providers about how to make sure that the community is accessing medicine safely. And right now, as we do this screen virtually, we know so many Americans and people around the world are getting healthcare virtually as well. And John's going to talk about the pitfalls and opportunities that can bring for patient safety online. With that, I just want to thank again our panelists who you'll hear from later in today's session, some experts from the community in New York, and in particular, leaders in their field in patient safety, Dr. Arash Devastani, from the Dean of the Long Island University School of Pharmacy, Rebecca Kavanaugh, who's Director of Co-Curricular and Development Portfolios at Touro College of Pharmacy, and Michael Liu, who's also an Assistant Dean of Clinical and Professional Affairs at Touro College of Pharmacy. We're so grateful for their leadership and engagement on this topic. We can't lead without healthcare providers taking the lion's share of the burden in educating patients. And as you'll see, doctors and pharmacists and nurses are on the front line as most trusted healthcare providers to educate patients about how to access medicine safely. So thank you to you three as panelists and our leading experts today on today's topic. With that, John, as board chair, I'm going to turn it over to you to talk, to just do the introduction to why we need to care about these topics and provide us some additional data. Thank you, John.
Well, thank you, Libby. Really appreciate that introduction. And it's my absolute pleasure to be here as ASOP board president, as a licensed pharmacist and someone who's been very engaged in these issues. First, just a little bit about the ASOP Foundation and the important work that it does. It's a not-for-profit headquartered in Washington, D.C., with projects really around the world, reflecting where ASOP's presence is, as Libby just suggested, with the US, Canada, Europe, India, and Asia being on our list. One of the great pieces of work, and one of the many great pieces of work that the ASOP Foundation does, is engage in meaningful research. We don't want to just guess where our efforts need to be. We want our efforts to be driven by the data. And so we're, in addition to describing the issue, going to review some data that's relevant to this issue today. We educate, we do research, and certainly we then influence and hopefully collaborate with not only those in the healthcare community, but also other stakeholders on our list. Next slide, please. A little bit about me, and this presentation is not about me, and so this will be a quick slide, but if you do have any questions about the work that we are doing, if you want to follow up as a potential collaborator, I do strongly encourage you to reach out to any of us as part of this webinar so that we can get you engaged. Next slide, please. The issue of internet sales is not just limited to HIV and PrEP products, and we have existed as part of ASOP and the ASOP Foundation for many years now, engaging in this work, and specifically in New York City pre-pandemic. Now, if you take into account all the challenges that the COVID-19 pandemic has brought us, from accessibility, resource constraints, it has only amplified the need to talk more about internet sales as more and more consumers are going online to access products for a variety of reasons. We were already trending that way, and again, we'll show data that demonstrates that. But when we are stuck at home, when there's lockdowns, when we have decreased access at brick and mortar stores, naturally people still need to access those products, and they're going to go online. So the reasons that held true pre-pandemic still hold true post-pandemic, but are only amplified. And those three main reasons are convenience, cost, and access. Time and time again, the data supports that the reason that our consumers, that our patients go online is it's more convenient. It has the perception of being less costly. And certainly there are access issues. In this country and around the world, there are pharmacy deserts, there are access deserts where people really struggle to access medicine, not just for financial reasons, but also geographic, socioeconomic reasons as well. In our HIV and PrEP population, one of the main drivers is the desire often to stay anonymous, is maybe not wanting to go into a sexual health clinic or not able to go into a sexual health clinic. And so cost isn't always that major driver. Sometimes it's that convenience or that wanting to be anonymous or access issue. Next slide, please. Now, going online isn't inherently bad. And I think we live in a world today where to tell a patient that don't go online makes absolutely no sense, especially in the shadow of the COVID-19 pandemic, when we want people to be able to access care in a variety of different modalities. The major problem in lies is if we just tell people to go online without the resources to do so safely, it opens them up to a variety of risks, because essentially they're bypassing, again, if they don't go through the traditional healthcare pathway, they're bypassing all these checks and balances that are in place, from the prescriber who's doing the diagnosis and trying to determine the appropriate therapy, from the pharmacist who's then reviewing that order, making sure it's appropriate, providing guidance and counseling, to all the regulators that make sure that the medicines that are being provided are approved and that proper activities are in place to ensure that if something does go wrong, that it's documented and then mitigated. And so going online obviously is going to bypass a lot of those inherent protections in the system. Next slide, please. Oh, and by the way, there are lots of opportunities to bypass the system. Between 35,000 and 45,000 online pharmacies exist today in the current environment online. About 95% plus or minus of those are illegal in some way, meaning they do not abide by the laws and regulations of the country, whether it's the US or another jurisdiction. And many of them provide substandard, falsified, or counterfeit medicines, which is a large patient safety risk and growing patient safety risk. It's a very complicated industry, and if we go to the next slide, it takes advantage of our very complex supply chain. And this is not a supply chain lecture, and so I won't go through this in great detail, but essentially what happens is you have a consumer that, say, is in the United States. They think they're going to either a US or maybe even a Canadian-based pharmacy. I think we all trust our neighbors to the north, and we have an inherent sense of quality in the products that come out of Canada. And so criminals take advantage of that and say they're from Canada, but they're really not. And so we go to that Canadian online pharmacy. It's actually a server that's hosted maybe in Russia or Brazil. It processes our order through a bank that might be in, say, Azerbaijan. And I'm calling out these countries by name, not to humiliate them or not to pick on them, but there is evidence that this is exactly how this works. And so I'm using this only as an example, but it processes in a bank in Azerbaijan. It fills your order, say, in Mauritius or India. That product that was made in Mauritius or India, which maybe 50% of the time is something that's of any quality, let alone the proper quality, that then gets shipped from that jurisdiction to Canada. There's a middleman in Canada that slaps a maple leaf on it that makes it look pretty and then drops it in the mail so that it ends up in your door in the US. So essentially, consumers think they're getting something from Canada, but it's traveled all over the world and it ends up at their front doorstep and you have no idea what it is. The same holds true for our HIV and PrEP products, where maybe you want to stay anonymous. Maybe you can't make that trip to the sexual health clinic. Maybe you're struggling to access for financial reasons. Maybe your physician told you, don't worry about going in, stay at home and just order from CanadaDrugs.com. But at the end of the day, your product may be counterfeit and has a high likelihood of being dangerous. Next slide, please. And essentially what I said, a huge issue with substandard falsified products online, risks of over and under dosing, drug interactions, adverse events. I mean, if you think about it, patients really don't know what they're getting. And there's big business in illegal online pharmacies. Online drug sellers can make anywhere between 1 and 2.5 million in sales each month. This is now more lucrative than illegal arms sales, human trafficking, and many other criminal enterprises. It's easy to get into and you make a lot of money, unfortunately. And so we have a lot of people who are doing it. Every day, approximately 20 new illegal online pharmacy websites go live globally. As I suggested, this is a significant patient safety issue. A few snapshots of some of the manufacturing, I'm going to use that in quotes, facilities that are making some of these products sold online. Clearly, this isn't anything we would want our patients to have. And then 95% of these online drug sellers operate illegally. So if we have about 40,000 illegal online sites, 95% of those are illegal. There's a significant number of illegal websites available, making it very difficult for our patients to navigate those safely. This is a huge opportunity for healthcare providers, policymakers, other stakeholders to get our patients and get our consumers educated. Next slide, please. Just a listing of some of the different poisons and other products that we find in substandard falsified medicines, from mercury to uranium to road paint, sheetrock. Antifreeze is on this list, and antifreeze is one of the more devastating ones. You don't know this and should never know this, but antifreeze is actually sweet to the taste, and so some of our particularly evil counterfeiters use it to sweeten medicines, and oftentimes sweeten medicines that are in liquid form. Liquid medicines are often meant for our kids, and so antifreeze ends up, and there's a number of case reports on this from around the world where kids have been poisoned and killed because of antifreeze used as a really cheap sweetener. Just absolutely horrible stuff, and we would never ever know. Next slide, please. I alluded to this. Our work in New York City began at the end of 2018 and beginning of 2019. And we had a number of really formative meetings in New York City around making sure that patients have access to HIV and PrEP products, making sure they were educated that even if it was an inexpensive product and cost wasn't the driver, that maybe it was the desire to be anonymous or just the convenience of staying at home, that we needed to have a really robust educational campaign around online purchase of HIV PrEP products. And this happened all in the beginning of 2019 when we set up meetings with individuals that you see on this call and our panels, other stakeholders, which was excellent. Oh, and then the pandemic hit. And the pandemic hit, and all it did was amplify the issues that we had been describing in New York City before the pandemic. Within weeks of COVID-19 pandemic being declared, over 100,000 new domain names were registered online with names like COVID and Corona and virus. Many of these, 122 specifically, had vaccine right in the beginning. So obviously there was no vaccine available, and we were already having information and potential products claiming to be vaccines. Long story short, criminals here have taken advantage and continue to take advantage of fear and uncertainty, where people don't know where to turn for either information or products. And so they go to where we all go, which is Google or Bing, and we type in something and we hope for the best. But with the COVID-19 pandemic, a lot of those products obviously were not FDA approved, were not Health Canada approved, were not approved by the jurisdictions in which they were sold, but they were being peddled as products to either cure or save you from COVID-19, taking advantage of that fear and uncertainty and only amplifying our messaging that we had been describing. Next slide, please. And they took advantage of this growing shifting behavior in e-consumerism. And this has largely been occurring where we've been putting more information in the hands of consumers so that they can make their own educated decisions about healthcare. The problem is if the information isn't good or isn't provided, then our consumers and patients can't make good decisions online. And we had been seeing this trend, which again has only been amplified by the COVID-19 pandemic. And it was important for us as an organization at ASOP and ASOP Foundation to better understand consumer behavior so that we could provide tailored, targeted messaging. We could arm our healthcare providers and other stakeholders with the right tools to ensure that our patients were making good decisions online. Because we can't tell people don't go online. Here's how you go online safely. And allow me to present some data that backs up that plan. Next slide, please. We have been engaged, as I said, in this issue for many years, and we have conducted a variety of different surveys. There are two that compare our comparators here, one from 2017 and one from 2020. And we just wrapped up another survey from 2021 that I'll go through here in a few slides. But just to compare 2017 to 2020, the very beginning of the pandemic. And this was asking patients from around the United States, for what medications would you buy online? And you can see that each one of these has a dramatic rise in the number of people who would order these online. From medications from acute conditions going from 23% to 72%, OTC products going from 34% to 80%, specialty medications from 21% to 67%, and chronic conditions from 42 to 78. So in each one of these, we have a really precipitous rise in the number of patients that would go online, which makes sense because we're asking many of these questions when the pandemic has occurred, and now they're going online for everything from Oreos to toilet paper to now blood pressure medicine, right? So this completely makes sense. And if we go to the next slide, we'll see that this has only continued after or in the shadow of the pandemic. So this was from our recent study in 2021, where 1 in 4 have now used an online pharmacy, which represents a 7% increase from the data I just showed you from 2020. 42% have purchased a medication online for themselves or a family member under their care at some point in time. So this is an issue that is not going away. Our patients are going online. So for us to ignore, and I say us, the collective healthcare community, to ignore this would be to miss a major opportunity for us to educate our patients, provide them with the tools to do so safely so they don't just go off and do it themselves, which they will do because that was going to be a trend in e-consumerism already. So if we go to the next slide. This is also from the more recent study in 2021, where 1 in 3 directly link their first use of online pharmacies to the pandemic because of the fact they weren't able to get to their brick and mortar store, because they were fearful of going out. And if you add this data together, 49%, so nearly half, say they tried ordering prescription medications for the first time this year. So this trend that we were seeing that we would have predicted in 2019 to maybe happen in 5 to 10 years happened in like 6 months. So this was an issue that continued to grow during the pandemic. Next slide, please. This is not just a phenomenon of the pandemic or of the lockdowns. Many will continue to use online pharmacies after the pandemic. It's one of those things where you tried it, you like it, now you're going to stick with it, regardless of what the environment is or if the environment's changed. So 62% plan on continuing to purchase their medications online post-pandemic. Next slide, please. We know that consumer behavior continues to shift to going online to buy everything, including medicines. That's what our data just suggested, is we have at least half, if not more, that are going online now to purchase medicines in some way. So then it would make sense that our healthcare professionals are engaged in talking about that source of medicine, that have a really good idea of how to then provide our patients with the information to stay safe online. But that's not happening either. So this is from our 2020 study, where we asked our health providers discussing online pharmacies, and we broke it up into 3 buckets: our nurse colleagues, our pharmacist colleagues, and our physician colleagues. And regardless of what type of profession, the vast majority never ever talk about online pharmacies. So now we have at least 50% of our patients are using them, but we never ever talk about it. So clearly there's a gap here. Then if we look at, let's just pick nurses, picking on nurses, but it's the first one on the list, that when they do engage in that dialogue, which happens about 27% of the time from our 2020 data, 11% of the time they highlight the risks and they say, look, this is the risk of going online. These are the tools that you need to help do so safely. So that's great. We want to see that dark blue be as big as possible. The problem is the lighter blue, 16%, they say, yes, no, just go online, it'll be great. Well, that's not enough, right? It's go online, here's where to go and go engage online safely. That's where our toolkit comes in. Our toolkit that we've developed and we're going to make available to all of you on this webinar and widely available on the website is designed to fill that gap between lots of patients going online and not a lot of conversations happening about it. You're going to help use that toolkit to begin to engage in dialogue and productive and meaningful discussion about how to go online safely. And if we go to the next slide, this was the 2020 data. Here's the 2021 data. And as you can imagine, the issues have only continued to be amplified. Where now our patients who are going online go to 27% use medical professionals as the only source of going online. And what I just showed you said, we don't really know how to talk about it. So now we have people that are asking about it, that are engaging with our health professionals, but our health professionals are probably not providing the most accurate, up-to-date information. Again, what a great role for our toolkit to play is help our health professionals in the broader community engage in meaningful discussions about the risks of going online, certainly for HIV and PrEP products, but also for everything else, because as we know, our patients aren't likely just taking one medicine. They might be taking multiple, and especially our older patients, as they age into that area where they're taking multiple medicines, the same studies show that the average American takes over 3 medicines that's taking medicine. So it's not just one, it's multiple, and so we need to be giving a very clear depiction of where to go and what to do and how to engage online safely. Next slide, please. Specifically looking at pharmacists, because we talked a little bit about healthcare professionals, and I mentioned nurses and physicians, but I want to focus a little bit on pharmacists. And the reason being is I am a pharmacist, and I think pharmacists as the medication use experts are ideally positioned here to engage on this issue. The problem is that greater than 50% of licensed pharmacists are not confident in their knowledge on the prevalence of illegal online pharmacies, their ability to detect or determine legitimacy, and then the types of medications sold. Now, this data is from 2019. My hope is that we've moved the needle on this at least a little bit, but I guarantee you we're not perfect, right? So we have a lot of opportunity to educate the medication use experts on the use of online pharmacies. Next slide, please. And that brings us back full circle to the really important engagement that we've had in New York City around HIV and PrEP products sold online. To start this development and kind of start this cascade, and I'll give credit to my colleague, Matt Rubin, who was engaged with me on this issue when it first started, is we collected a lot of information. We did a literature review to see what was out there around HIV and PrEP products. We commissioned a study by LegitScript that helped give us a really nice overview of what was occurring in the New York City area about this. And all that data helped us then determine who do we need to engage with in New York City to build a coalition, because this has to be multidisciplinary, around educating the consumer on how to go online safely, specifically as it relates to HIV and PrEP products. So we developed key partnerships with clinical and academic partners, as well as downstream engagement with patient groups, caregivers, and allied organizations. We had a series of in-person, surprise, surprise, in-person meetings in early 2019 with HIV and AIDS leaders in New York City, including great partners from NYU Langone, St. John's, Truro, Long Island University, as well as Mount Sinai. And I'm just so fortunate that we have some of those stakeholders with us today to talk about their experiences with this issue. And if we go to the next slide, please. All that information, all those meetings, all that work helped lead us to the development of a healthcare provider toolkit, which is designed to fill that gap between what people are doing and what we're actually engaging with them on in terms of education, to discuss the risks of poor, substandard, falsified, or black market HIV PrEP products, and then message some key points. This toolkit is robust. There's lots of information in it. I don't have time to go through all of it, but there are resources, references. The goal of this toolkit is to educate health professionals who work with HIV at-risk populations and patients themselves on the risk of buying PrEP through illegal online or gray black market brick and mortar sources, and ways to then access safe, legitimate medicine, including PrEP, but everything, because a lot of these tips and tricks apply not only to HIV PrEP, but to other medicines as well. Materials that you find in the toolkit can be co-branded, meaning we do not want you to recreate the wheel. If you want to use some of our materials, let's co-brand with your logos. So that way we demonstrate this combined collaborative commitment and dedication around patient safety. If you're willing to co-brand, reach out to us. I mean, you can use the toolkit no matter what, but if you want to co-brand, we would love to engage with you in further discussion on how to align your educational efforts. We also want to make sure there's continued dialogue with all partners. This webinar does represent the culmination and creation of the toolkit, and we get to talk a lot about our data and our work, which is really exciting, but this is not the end for us. We have a lot of work that still needs to be done in jurisdictions in places like New York City, but we want to spread this far and wide. You know, I think New York City was the pilot, it was the proof of concept, but we want to continue to reach out to other allies. So if you're on this webinar and you want to engage with us, please reach out because we want to continue to engage on this issue and identify other leaders so that we can spread the message far and wide. We can only yell so much between Libby and I and others. We want everyone to be yelling along with us. Next slide, please. Some key takeaways as we transition to the second phase of our webinar today. We definitely need to increase consumers and patients have used the internet more today than they ever have before to buy medicines, okay? And online pharmacies can be safe, they can be cost effective. We're not saying don't go online because I don't think that's a realistic ask, but you need to go online safely and your patients need to go online safely. And there are ways to do that because if we don't engage in that dialogue, statistics would suggest they're gonna fall into one of those 95% that are illegal. And then they're gonna likely get something that's substandard or falsified or just not work, right? Pharmacists and other health professionals have limited knowledge on this. We need to do better. We need to educate ourselves and educate our colleagues. And this is certainly a global issue that can result in serious negative public health effects. When we're talking about an allergy medicine not working, and that can be bad enough, you know, there are significant risks that come with substandard falsified allergy medicine. But when you're talking about HIV and PrEP not working, now you're talking about a public health issue. And so this has so many different angles. No matter the issue, we need to make sure that we're staying ahead of it because educated consumers do take less risks. More education is needed for ourselves so that we can educate others. And please do use those resources that we've suggested here and that we'll be following up with to stay safe online. Always, always, no matter what, if you have an opportunity to engage and intervene with a patient, always ask not only what are you taking this for and what did the doctors tell you to do, it's where did you get it? Where do you get your medication? Do you get it all from me? Do you get it from the pharmacy down the street? That's fine, but where do you get it? Do you get it from CanadaDrugs.com or Canada Online Canada Pharmacy? Well, if you do, let's have a discussion about that. Okay, so always ask where do you get your medication? Next slide, please. That concludes my remarks. Like I said, I wanted to make sure that we leave plenty of time for our esteemed panelists to engage in some really meaningful dialogue on these issues. And so with that, I think we're going to move to our panelist discussion here on the next slide. I'm so pleased to have Arash, Rebecca, and Michael joining us today. What I want to do is open it up with just a general question first. And if you have a question, let me pause. If you have a question out there in the audience, please type it into the Q&A box. I will be monitoring that and we'll make sure we get your questions answered. But to kick things off while I'm collecting Q&A questions, I'd love to get all three of your impressions of the engagement we've had in New York City, the issue that I've described, and maybe even some of the data that I presented today. Do you have any reaction or can you provide any context based on the work that you do in New York City that would provide some additional helpful clarity? And Arash, you're first on my screen, so maybe I'll go to you first.
Good morning, everybody. Good morning, John, and thank you for the introduction. And thank you for such a thorough, comprehensive presentation, providing real-world data on the scope of the problem. So absolutely, I'm happy you presented that in that particular fashion, backed up by data, as I mentioned earlier, and it just really further emphasizes the scope of the problem. Exactly as you alluded to earlier, this is a problem that's not getting smaller, it's actually getting bigger, mostly exacerbated by COVID. I would also ask that, as many of you may have noticed in the news a couple of years ago, if there are bad players out there making rice and selling it out of plastic, then I can only imagine what sorts of those ingredients they're placing into these non-monitored, non-oversighted drugs that's being ordered online. So thank you.
Thank you, Arash. Appreciate that. And Rebecca, what do you think?
I was just going to agree with your comments and Arash's comments, and also just mention that, you know, in vulnerable populations, especially people living with HIV, there are already larger existing disparities, and it's so large that we can't even quantify all of them. They're facing discrimination, they're often facing racism, they may be facing sexism in every aspect of their lives. And when you think about that as a barrier to care, and you know that every time a patient is interacting with a healthcare provider, with a pharmacist, with a doctor, with the receptionist at the front desk, all of those interactions are opportunities for patients to face stigma and discrimination. And so it's really not surprising at all that these types of, you know, when these issues come up, patients want to go online, which is really one of the last places that is a little bit more of an even playing field, where people won't be judged based on their appearance or their HIV status. And so I think that really accentuates why it's so particularly important in our HIV positive patients, and why we need to find not only ways to help them shop online safely, but also to ease the discrimination that they might be facing in our clinics and in our healthcare arena, so that they're more comfortable using those other safe ways to get their medication as well.
Rebecca, thanks for sharing that. And you know, with every project I learned something, and I think that was probably the major learning that I had out of this work was, you know, I think when we talk to patients, when we ask why they go online, the number one thing we all predict they're going to say is because it's cheaper. And I just assumed it was going to be the same way with HIV PrEP. And it's not necessarily cost. I mean, it can be, but it's not necessarily cost. It's these other factors that are so challenging for this specific population that may lead them to go online. And if we don't help them navigate the internet space safely, they can fall into the same trap, whether the reason was cost or something. I do really appreciate that.
And John, I think this is Libby, I think that's emphasized with this issue in particular, where you're seeing increased access channels through state and federal action, and yet people are still going online. So Rebecca, your point is underscored by the research and policy developments that create access channels and that aren't being taken advantage of in the ways that we might have anticipated, because the internet as an outlet for other reasons that patients might seek access to care. And so that is something that we've seen both domestically and globally. Even where there's, you know, government payer for all sorts of medicines internationally, we still have seen illegal online drug sellers taking advantage of patients in those international jurisdictions for the same reasons you mentioned, Rebecca, trying to find other access channels for reasons that are outside of just the primary driver of cost.
Yeah, I think you mentioned about the government, channels and government assistance programs, and those are so, so important to our HIV positive patients. But then you also have to think about the fact that the way these systems are often designed to reduce costs to the taxpayer and also to reduce the resources needed to run the programs, because of course with cost comes resource shortages. And so when you have systems created with those barriers, you find a system that is created to serve not the patient. It serves the providers, it serves the government, programs. It runs as cheap as it can, but it's not created with the patient at the center, with the patient as the most important stakeholder. And whenever you have systems that do that, you have a difficult to navigate, healthcare system for the patient. And so the people who need the help the most are the ones who have to do the most work to get it. And I mean work like paperwork, filling out applications, showing up with documentation, pay stubs, housing, proof. The list is incredible for people who are using those programs compared to me having my private insurance card, walk in and I'm done. So it's even when there are systems in place, umbrella systems and safety net, even that is difficult for patients to use.
And that's such a contrast to the open internet too, where it's, a couple clicks and access, seemingly safe products. And that point about doctors, pharmacists, and nurses having trouble distinguishing between safe, legitimate, FDA-approved sites that sell medicines versus those that don't is troubling from a healthcare provider perspective. Let alone the population you're speaking of, Black and women are already put at a disadvantage from people working at bureaucracy burden, and then have to go to the internet and distinguish between legitimate sites and those that are offering counterfeit or substandard products. A real troubling set of circumstances, and it really compels us as healthcare community to come up with better solutions.
All right. Well, and I was told a long time ago, make the easy way the right way. And I don't know if we've made the easy way the right way on this issue yet. So I do want to transition to Michael. Michael, would love to get your opening thoughts as well.
Okay. Thanks, John. I mean, really taking everybody's, feedback into consideration in John's presentation. I think like Rebecca mentioned, the online accessibility, is scary, but I think what's even more is the survey you guys conducted that shows that healthcare professionals assume that, everything on pharmacies online is safe, shouldn't matter where it comes from, right? Ultimately, to get to the patient, right, at the lowest cost possible, right? That's the general model. But the issue of safety is a big issue, and there's really two folds in terms of healthcare professional, where we could update our college curriculum to ensure the next generation of pharmacy students know what they're talking about. But what about the existing professionals, like you guys mentioned, pharmacists, nurses, physicians, providers? How do we get them up to speed? Not to mention any names, but remember in the health system, we had a drug shortage about 5 years ago with insulin glargine, and one of them said, "Oh, let's get it from Amazon," and we're all just like shaking our heads, But oftentimes we'll look at, let's say, the board, every state's board of pharmacy, to look at the manufacturer, repackaging status. But these are not easy to use, right? And when I went to the ASOP's website, for consumers, you guys have these easy to use, very efficient resources, as well as the prescription assistant recommendations you guys have. So I think, like, kind of to Rebecca's point and your point, John, it needs to be easy, efficient, and reliable. That's what the patient wants, but that's also what we healthcare professional wants as well.
Thank you, Michael. Any reaction? And I see in the Q&A, there was one comment that I'll bring up related to what Michael just said, and that I know there's some work being done around curricular development, and my research team has been somewhat engaged in that, as others have as well. But what do we do for the professionals that are graduated, that are already out there? And maybe is there an opportunity to develop some short-term education programs in partnership with academic institutions to provide some more just-in-time training that may help catch some people up to speed? So I don't want to lose that point, because I do think it's an important one. Any of the panelists have any reaction to the discussion so far? I saw some heads nodding.
Hey, it's Michael. I'll take
go ahead, please.
Yeah, I'll take a quick stab at that. A lot of the state requirements do require pharmacy law as a continuing education requirement. So that's one of the education forefronts I think we can tackle on to ensure, again, just-in-time education. Another area within pharmacy, technicians are getting certified, right? A lot of states are mandating that. So we need to leverage pharmacy technicians as well. Because, as pharmacists, we're doing a lot of clinical work and patient interaction, but the technician can also aid us in that as well.
Well, let me ask another question. Oh, please, Rebecca.
Oh, I was just going to say, I think digital health is an incredibly important part of like any pharmacy's curriculum right now. I mean, I think all schools are investigating the role that digital health will play in patient care going forward. And that includes topics like this about patients shopping online for pharmacies, but it also includes like access to other healthcare venues using digital technology. And we've already been doing this for years, and the VA has also done this for a long time as well. But I think it's time for us to do it in a directed way. And, just how we mentioned before about serving the patient first. So teaching pharmacy students, medical students about these like pharmacies that are available online and how to find the correct ones to use and how to shop around correctly. That's going to become as important as all of the other patient education techniques that we train our students for. And I know, even though I'm young, when I was in pharmacy school, I didn't learn anything about online digital health or anything when I was in school. So obviously things have changed a lot in the past 5 years alone. So I think we all need to take a look at our curriculum and find a home for digital health, including these types of patient education initiatives.
I think it's now a due diligence on the parts of students, interns, recent graduates, existing alumni, and all pharmacists out there. I think that would be the most appropriate approach, is that it is 100% a part of their practice. It's an element that we just can't ignore.
So building on that, because I think we're dipping our toe into this issue, is how has the pandemic changed how patients access care? Clearly we are in a different world now than we were before. How in your view has that changed how our patients are going to access care, and what can we do about it in terms of accessing it safely?
I'll take a stab at this one, John. I think if we start out with the fact that most payers, if not all payers, really highly encourage patients' access to remote health, whether that be a virtual physician consult or any other form of virtual health, remote health, for two reasons. A, it's less expensive for them, for the payers, and B, it actually does provide some level of healthcare for the patient, rather than patient being really ignored or fallen through the cracks of the U.S. healthcare system. So I think if we start out with that and educate patients that this is really a preferred way of getting health, rather than not getting attention, health, etc. And then secondly, obviously we have to acknowledge that with COVID, less people are going out, less people are having face-to-face interactions, and more ordering online of not just drugs, but other things, other products and services, that most, if not all pharmacies, at least here in the New York City metro, do offer a free delivery or shipping, which many patients I don't think are aware. So that might be another angle to the awareness conversation.
Yeah, Arash, thanks for providing your perspective. I know you've been really engaged in kind of what the future holds for those types of practices. And I love this idea around the delivery piece, because I think that is another mechanism we probably don't promote as much. And I know, at least in our local area here, in the beginning of the COVID-19 pandemic, there were lists circulating of local pharmacies and who delivered and what was free. And I'm guessing we're not the only ones that helped develop those localized tools. So I do appreciate you pointing that out as another method of access, because we know that's one of the top three ways to access medicines. What, Rebecca or Michael, any reflections on the implication of the pandemic and how our patients are accessing, or how our students are interfacing with patients and educating patients?
I can start. I would just say a lot of students during the pandemic, they were doing rotations virtually through Zoom. They're seeing patients like this on a webinar type of format, with a screen and a camera. There are many patients who aren't great at using, things like Zoom or WebEx, so they may have difficulty turning on their camera. They may not have, consistent smartphone that can easily use applications like Zoom. So I think the access really became even more difficult for our most vulnerable patient populations. It's difficult to use translating services using these online platforms. It's clumsy. You can't read patients' body language as easily, so it's a lot harder to do a patient visit. But there are some advantages, for our patients who are working long hours, who have a long commute, who live far from the clinic. It's a lot easier for them to come to an appointment when they can join using online, platforms. If they can figure it out, it's a great tool. But I do think it's just different. And because none of us were necessarily trained on how to run these types of visits in this way, and because patients aren't familiar with joining visits in this manner, it's a learning curve for everybody involved. So I think this change is probably here to stay. It probably will, do more live visits and a few less virtual visits once COVID starts to ease off. But I think going forward, this isn't going away anytime soon.
Yeah, just to piggyback on Rebecca, I mean, if you look at an article last month, I remember when I was presenting, now internet access is expanding even more so, right? Like kind of like what you mentioned, John, earlier. The COVID augmented what was already going on. Okay, well, it wasn't like all of a sudden COVID, all of a sudden everyone started ordering from the internet. It was already there. It was just getting worse and worse and worse, more and more and more, not worse and worse. And I think to Rash's point, the delivery of that is extremely important, because no matter what you order, right, ultimately the last step is reaching to the patient. So if you're able to control that last step, that critical path, to get to the patient safely, we can understand all the delivery networks to that, whether it's through the postal service or what have you. I think that's more important, to control that last critical point in order to ensure the drugs are indeed safe and of quality.
So we've been talking about the internet, obviously, because that's one of the main focuses here, but part of the internet are social media platforms. So it's not just traditional websites, but now sales through Snapchat and Instagram and others. I would just love if you do have any thoughts, because we didn't really talk about this as much in the presentation, but do you have any thoughts on that as another modality for the sale of illegal products?
It's a huge can of worms, because we don't know if the social media platforms are screening their advertisements. I would assume not.
Yeah, I agree with Arash. That's definitely a big can of worms. I mean, there are ways you have to work with the social media to trigger safety. Like, for example, every review of healthcare related product must go through X, Y, and Z organization. But I think that's in its infancy. Perhaps we could look at that as well.
Yeah, and I'll just add that I think so there's studies that have shown that the proportion of people who get their news and important information from social media goes up every year, and now it's a significant proportion of where people receive their news, and many people receive all of their news from social media. And for whatever positives and negatives cable news and reporting may have, there is a level of editing and judiciousness that goes into reporting things on cable TV and on the radio and in newspapers. And social media has none of that, of course. And we also know that social media programs and applications deliberately produce to us information that we want to see, whether or not it's accurate. And this is not a political statement. This is just a fact. So when you see that both sides and all the sides that there might be are getting information that they already believe and reinforcing information that they already think to be true, that really creates a problem when there's new developments like COVID, where new information is coming out every day and people really need to have the most accurate information. And so obviously people who are getting their news and trusting these social media websites are more likely to purchase products through these social media sites and trust that those products will be authentic when perhaps they are not. So I think that that's a really important point that you brought up, and I think it's going to be an even larger issue going forward. And as we know, Amazon has already been trying for years to open up pharmacies, and I'm sure Instagram will have a pharmacy and Snapchat, and everyone will have one as soon as they can. So I think this is going to only become more and more of an issue for our patients.
Yeah, I'd say, Rebecca, just to build on that, that a lot of those platforms already have pharmacy actors on them, whether digital drug dealers or actual, pharmacy services. And so I think the challenge is, as we've discussed, is how to clean up those platforms, or at least overwhelm the platforms with, evidence-based information that can steer people that are getting their news or getting other forms of online shopping from those feeds, how to feed the right things to the patients at the right time and try to take out or to demote, or in some cases de-index, or otherwise have systems and processes in place to push down content that is dangerous to public health. And that pervades across the pandemic. We've seen, the US FDA and a variety of government organizations across the globe sharing that same message in the pandemic about vaccine hesitancy. The interesting thing for the Alliance for Safe Online Pharmacies has been, we've been at this table for, a decade saying the same thing, which is you can't always trust everything you find on the internet. That's been acutely put in front of the global population when it comes to vaccine hesitancy, but the longer term implications for global public health are access to medicines and medicines we can trust. And if the sources of trust devolve into social media actors on an anonymous basis, tweeting about some cheap drug from some foreign source, it's really dangerous. And so part of the Alliance's work is both to help give you all the toolkits and learn from you about what the community really needs. So how do you educate, the next generation, to your points, of students that can help steer people to the right direction, but also what are some of the other structural changes that need to be made, both in policy and in law, so that that we don't have to only educate our way out of the problem, because we know the algorithms are better than our day-to-day education. They just are. And so we have to try to do better structurally as well. And part of our mission is to think about ways to do that on a global basis. And so we would love your feedback on that as you see the real-time work with students and in the community about what is changing behavior. We hope that this continues to be a dialogue with the foundation so that we can help think about those systemic and structural issues that need to be addressed as well.
One quick, hopefully final note about social media. Let's not forget about cookies. I mean, they make it easy. Someone is out on Google searching about any of those topics that we discussed, and the minute they open any one of their social media platforms, there's going to be a cookie pop-up going after them with some targeted advertisement, which will really make it significantly simpler for them to order.
So as we close in on time, and I think this comment about misinformation is really important, because it's not like we're just fighting against no information. Oftentimes we're fighting against wrong or bad information, which makes the task even more challenging. So speaking of challenges, and maybe as we close out our discussion, I'd love to hear from our panelists, around this issue, what do you think our biggest challenge is? But then simultaneously, to leave us on a really optimistic note, I'd love to hear what's the biggest opportunity for us all as we engage on this issue with either patients or with our students. And I'll go in reverse order. So Rebecca, you're up. Or Michael, you're up first.
Thanks, John. I think the biggest challenge is what we all just talked about a minute ago about social media, and also, I mean, we could have all the artificial intelligence, all the data analytics to help guide us, but from a regulatory standpoint, which is Libby's area of expertise, are there regulatory compliance required for these companies, these large entities, to comply with these safety measures. So that's the challenge. But on a positive note, we are all aware of it. I mean, this global foundation, the mission is to advance these, and also as part of academia, Arash, Rebecca, and everyone else, we are always moving forth with our curriculum, with our alumni, to make sure they have the tools to educate the patient. So, these criminal entities are adapting. You know what? We're adapting as well. So I think that's where we have a lot of opportunities to deal with.
Thank you, Michael. Rebecca.
So I would say I think our biggest challenge is changing a system that is designed to work for us and making it into a system that is designed to work for the patient, and meeting the patient where they're at without asking them to do anything, to jump through hoops, to go places, fill things out. I think being able to go right directly to them, the same way that Facebook and Instagram goes directly to the people they want to reach with their advertising. If we can go directly to them and meet them where they are, I think that would really improve all of the outreach that we're doing with patient education and flooding the arena with correct information and good resources that are safe for the patient to use. I think that's the most important challenge, and it's possible to do this. We have the tools and the technology. Obviously, private companies are doing it, and we need to become more savvy like they are. And throughout the pandemic, I know over and over I thought to myself, man, these people who are speaking on TV, they're so boring. They're not excited about the vaccine. There's no pretty pictures. I mean, how can you compete with that? So, we need to rethink our strategies and rethink how we reach the people we need to reach, because we know who we need to reach. We just need to actually get there. So I think that's our biggest challenge and our biggest opportunity in the next few years. And I think what Michael said about teaching our students to do this is obviously the most important thing for the future of pharmacy and medicine in general.
Thank you, Rebecca. And then Arash.
I don't have anything else to add. I think my colleagues just really summed it up nicely. So nothing else to add.
Okay. Well, we're coming up on time, and I want to take this opportunity to answer one last question I see, which is around international collaboration and ASOP's role. And yes, so the short answer is yes, we would love to collaborate. And so if you want to talk about a collaboration, we may have a presence in your area. If we don't, we'll still work with you. So please do contact us, and we'll be happy to talk further. I want to take an opportunity to thank all three panelists one more time. Thank you so much for your commentary and your insight and the work that you continue to do. We really appreciate it. I'm going to turn it over to Libby for any final thoughts that she might have, and then we turn it over maybe to Jillian. Thanks.
Yeah, just with conclusion, thank you again, everybody. Please do reach out to us at the Global Foundation. It's asopfoundation.pharmacy, where the tools and resources are available for you to download, use, co-brand. Don't be shy. This is a global mission, and we need everybody engaged. Thank you.
And thanks, everyone, for their time. We'll follow up, but please feel free, as Libby mentioned, to reach out. We have the contact information here, and we hope you all enjoyed this experience.